Hello and happy Thursday. Welcome to our community engagement webinar with Kauai Health CEO. My name is Deborah Volleson and I'm the Director of Community Engagement. And joining me, of course, is Gary Herbst, our CEO. And today we're going to talk a little bit about financials. We're going to talk about some changes in legislation, and we're going to talk about growth and anything else that we want to talk about. But before we talk about those things, no, I'm not trying to stump you. Why don't you kind of share a little bit about what we did this week out in front of the Asikwa wing? And we had some community members that joined us for that. And I've heard rave reviews about it. So you want to share with everybody?
Yeah. Well, if I could, maybe I'll back up over the last couple weeks.
Okay.
So just a couple weeks ago, we celebrated National Nurses Week. So we did a lot of wonderful things to celebrate and express our appreciation, our gratitude to not just our nurses, but really the entire organization, all the partners in care that support our nurses. And but it was just a wonderful opportunity for us to thank our nurses really across the nation, not just here at Kauai. And then that was followed the next week by National Hospital Week, which kind of culminated in our annual Starlight Awards ceremony that we have at the Fox Theater, where we recognize just some truly outstanding employees and residents and physicians here at Kauai Health with different inspirational awards and service excellent awards. And then the evening culminated in where we announced our Employee of the Year, who was Julio Sanchez this year. He's a 44-year employee with us, a registered nurse that works in our Sequoia Regional Cancer Center on the radiation oncology side. And just to see the shock on his face, you always hope
Can't believe we pulled it off
I know,
again.
when you throw a surprise party for somebody, you hope that it truly is
they
a surprise.
Show up. You really hope they show up.
Yeah, but Julio was definitely surprised and moved by the recognition, and so very deserved. And then this week, I think it was on Tuesday, we did the formal dedication of our Reflection Garden and Monument that is just outside, just west of the Asikwa Wing entrance. A beautiful, beautifully landscaped, serene, peaceful area that is marked by this beautiful, towering, almost a very pencil-like pyramid of sorts, a stone monument that has an eternal flame at the top of it, and it was completely designed, all elements, by one of our own staff, Greg
Bitney.
Greg Bitney, who's in our marketing department, who has a tremendous amount of artistic talent. So not only did he design the landscaping and the seating, the stone seats, and the recognition pavers, but also designed the monument and wrote the truly inspirational and beautiful moving poem that appears on the north side of the monument in English and on the south side in Spanish. And so Tuesday we got to thank the Shannon family. Eric Shannon was there in attendance. Eric and his family, and a number of other folks like Cal Water, and I think it was MSI Inc., another company, who had all come together to provide the funding for this beautiful tribute, really, to our patients. I mean, you think in our 60-year history, all of the countless lives that have been touched by Kauai Health and our caregivers, and it really was something that our nurses had brought forward. They came to our marketing department and said, you know, coming after COVID and just everything it has done and meant, we'd like to do something in remembrance of all the patients that we've taken care of over the years, including those that didn't make it, whether it was through COVID or some life-ending disease or injury that they had. Just a place for our staff, our doctors, to be able to come out, a little quiet time, you know, maybe having a hard day, and just to come out and sit on the bench and be surrounded by this serene landscaping and the monument, and just let their mind kind of escape a little bit. So, but yeah, it was a beautiful event, beautiful day, nice little breeze and everything, and had a great turnout. And then we had Brenda Isaac, our former retired nurse, who is an incredible culinary artist herself. Provided all of us with lunch and pulled pork sandwiches, and so it was just a great day, great moment. I'm certain that's why, yeah, you got all the great feedback.
Yeah, and we would be remiss, and Liz Wynn would be angry at us if we did not offer the opportunity to everybody to support that monument by sponsoring a brick.
Yes.
There were small bricks and there were large
different
bricks,
sizes.
different sizes.
Yeah.
With little sayings and little notes from families, and it was beautiful to kind of go around and read them. And so there's still that opportunity. They are growing that garden, and so if you're interested in sponsoring one of those bricks, just reach out to Liz Wynn and the foundation. And of course, when I said she would get mad, she wouldn't get mad. She would just
she's
have wanted
she's too
us
gracious
She's
to
very
get
cool.
mad.
She's
But,
very cool.
But
Yeah.
you also remind me, a big shout out to our hospital foundation and our hospice foundation, which also played a very integral part in bringing this vision to a reality. And yeah, if you get a chance, the pavers, they were designed so that you'll see a lot of blank pavers that are intended to be a place marker for an inscribed paver if somebody would like to put there. And they come in all different sizes and prices, but just an opportunity for an individual or a family to maybe in remembrance of a loved one, or to thank a particular caregiver or group of caregivers, whatever inscription that you would like to express. So,
All right, thank you. So let's jump in, Gary. We get asked often about seismic because we spent a lot of time back in 2017, 2018, really educating the community on the seismic regulations and requirements that were going to go into effect in 2030. So then the pandemic happened,
right.
and we kind of stopped talking about that and started talking about other things. And so we get the question often, is 2030 still looming? Are we still worried? And you have some information about some changes in those legislative recommendations.
Yeah, the answer to your questions, yes, yes, and yes. Yes, we're still worried. Yes, yes. So Senate Bill 1953, the seismic bill that requires all California hospitals to meet minimum seismic standards by specific dates. The most probably looming and important date is January 1st, 2030, where all acute care hospitals and beds and towers and units have to meet these very stringent and uniform seismic requirements across the state. So it doesn't matter if you're located here in Visalia, California, with a low seismic risk factor, or if you're in San Francisco or LA or sitting right on top of the San Andreas Fault, we're all treated the same. So that current law, Senate Bill 1953, still sits there unchanged. And so the deadline, technically by law, is still January 1, 2030. Our Mineral King Wing that opened in 1969 that houses roughly 206 of our acute inpatient beds. So units like 2 South, 2 North, 3 South, 3 North, 4 South, 4 North, which today are full. Yesterday at 7 a.m. in the morning, I was reporting to our board last night, we were at 102% occupancy. We only had 3 medical surgical beds in the whole, both the Mineral King Wing and the Acequia Wing that were available for a new admission. And we had close to 35 patients that were going to be admitted into the acute medical center, but were sitting in the emergency department waiting for a bed to open up. So every one of those Mineral King beds that are in currently non-seismically compliant space cannot be used past January 1, 2030. to replace those beds, and that those all of those meetings you're referring to, meeting with our community advisory committees, the Hospital of the Future, meeting with lots of legislators and other community members, we made the determination that we can't retrofit those beds or that Mineral King wing, but would have to build a replacement tower at a cost of about $750 million. And so I don't think we could have ever afforded, even pre-pandemic, $750 million. It's just an unfathomable amount of money, and there's zero funding coming from either the federal or state government or any other sources to support that. So we'd be entirely on our own to fund that. And so, and the pandemic did nothing but to exacerbate that. So roughly 40% of hospitals in California do not meet the seismic standards. I was up in Fresno Monday morning at Community Regional Medical Center. I was meeting with Craig Castro, who is the CEO of Community Health Systems. That they own Community Regional Medical Center and Clovis Community Hospital and the Fresno Heart Hospital. So Craig and I were meeting with Congressman Jim Costa and Secretary of Health and Human Services Javier Becerra, the former Attorney General of California. He actually was given the commencement speech at Fresno State on Saturday night and stayed through the weekend and met with us on Monday. And Craig Castro was talking about literally the entire Community Regional Medical Center, a level 1 trauma center with close to 1,000 beds that's located in downtown Fresno, does not meet the seismic standards and could not be used in beyond 2030. And it would cost close to $2 billion to replace it. And again, there's no funding for it. Fortunately, there's a couple bills that have been introduced that are intended to provide some relief to California hospitals. I think I've shared with you at past huddles that Assembly Bill 869, which was introduced by a state assembly member, Jim Wood, who I believe is a physician representing Healdsburg. So he introduced Assembly Bill 869 that would provide relief to small, rural, critical access hospitals and all district hospitals. There are 33 district hospitals in California. But that those categories of hospitals, because of the fact that they operate generally in more rural, more isolated areas, they tend to be safety net hospitals for the communities. They tend to have very high Medi-Cal enrollment, and the majority of their revenue comes from governmental payers like Medicare and Medi-Cal, and they don't tend to have the financial wherewithal, like some of the larger, more metropolitan hospitals. And so Assemblymember Wood's bill would provide, I think it's a 7-year extension to those eligible hospitals, so beyond that 2030 deadline, but would also allow those hospitals to apply for an indefinite exemption from the seismic standards if they could demonstrate that they did not have the financial wherewithal to be able to execute their replacement plan or their retrofit plan, which certainly would be our case right now. And so you would be indefinitely exempted from the requirements until such time as the state provided the funding to complete your project. So I don't know if that would ever happen, the state providing CWEA $750 million in financial support. But that bill is still alive, although it might be on a respirator, so to speak. The California Hospital Association has actually endorsed it, and the Association of California Healthcare Districts, which represent hundreds of special districts, including all of the different healthcare districts that don't have hospitals. So like the Lindsay Hospital District, the Alta Hospital District, the Kingsburg Hospital District, the Exeter Hospital District, the Tulare Hospital District. None of them have district hospitals anymore, but they're all still healthcare districts, and they're members of the ACHD. So that organization has also come out now to support AB 869. More recently, though, the California Hospital Association has been working with State Senator Ana Caballero, who's a Democratic senator out of representing Merced. She has been a strong supporter of healthcare. I've had the opportunity to speak with her on a couple occasions and kind of share our story with her. She's a huge advocate. She's very concerned about the seismic issues we're facing. She, I believe, represented Madera Community Hospital, or is very involved in trying to breathe life back into Madera Community Hospital, and hopefully it does reopen. But she is sponsoring Senate Bill 1432. So it recently passed a Senate subcommittee on a vote of 11-0. And so now it will go to the Senate floor for a full vote of the state Senate, and if it passes there, then it will move over to the Assembly side and go through committees and then eventual vote. The fact that it passed 11-0 out of the Senate subcommittee, that was really encouraging. So let me share with you some of the elements of that proposed bill. Number one, and this doesn't just apply to those small rural, and this applies to all 400 hospitals in California. It also would apply to Kauai, even though we are part of that AB 869. We also would fall under Senate Bill 1432. Although I think the 869 provides us better relief, broader and deeper relief than what Senate Bill 1432 does. So this would provide all hospitals with an initial 3-year extension to 2033, but you would have to submit your seismic compliance plan and how you intend to comply with the non-structural performance requirements. So, not to get it too complicated, there's 2 elements to seismic compliance. There's SPC, structural performance category. That's the building itself, mostly kind of like the exterior, and would it withstand, an earthquake and not be severely damaged or collapse. Then there's the non-structural performance, the NPC, which is all the interior of the hospital, the bracing of water systems and gas systems, and things being anchored to the floor and the walls, and so that in the event of a major earthquake, there would not be all these things falling and collapsing inside the hospital that could harm people or disrupt. So I think if we see relief, it's really going to come on the structural, allowing hospitals, to continue to operate, but still having to do all the bracing and everything that's part of, the original Senate Bill 1953. So 3-year extension, but you still have to show how you're going to meet all the NPC, and you have to file that all with the Department of Health Access and Information, more easily referred to as HCI, what we used to call OSHPD. So now HCI, but they basically do the same thing. They oversee hospitals. It could provide up to an additional 5-year extension, so 5 more years beyond the 3 years. This would be at the discretion of HCI, but you would have to submit information to them about the complexity of your project and your financial capability to support that project and the impact that it would have on access to care in your community. And so I think many hospitals, including Kauai, would definitely be able to support that request. So that potentially could give us an 8-year extension of the current bill. And that's designed to kind of shore up your plans, hopefully continue our financial recovery and our ability to provide funding to be able to help our community understand the story behind it. So in order to meet those extensions, both the 3 years and the 5 years, you'd still have to meet certain planning, development, and construction milestones that are still waiting to be determined.
Okay, can I ask a question?
Yeah.
So how far into that planning do you have to go? Because planning is quite expensive.
Yes, so the details of that are not yet spelled out.
So we just, we can't draw a little here's what we want.
No, well, we've done a tremendous
Right.
amount of planning, and we've shared a lot of that planning with the community, still envisioning a 10-story tower, 240 patient care rooms, a new dietary pharmacy. So we have detailed floor plans that have been developed by architects, and so a tremendous amount. And we've continued. Kevin Morrison, our director of maintenance and facilities, just submitted before December 31st. We had to submit additional plans. We had to show our NPC plans. We had to post signs around the hospital about our rating and everything. And so we've done an extensive amount of planning, but certainly we haven't put it out to bid or anything. And so, does that planning mean you have to show blueprints and stuff? I don't know the details of that yet. This bill would mandate that all hospitals must strengthen their disaster plans to ensure patients continue to receive the care they need during and after an earthquake, and workers would have to have a very clear picture of how patient care would be delivered in the event of a major earthquake, which is really one of the first attempts to pass new legislation. Was less about the seismic capability of the building, but rather, could a hospital continue to provide emergency care to its community in the event of, major damage to an earthquake? And we would do quite well under that. Between our Sequoia wing, the east expansion, the west expansion, we have a lot of very seismically compliant beds and ORs. Our whole emergency department pretty much is in seismically compliant space. So that was one angle that the CHA was taking earlier, and it sounds like that's would be required in this bill as well. One of the big things that this would do is, though, it would require HCI and the state to undertake a comprehensive assessment, which they've never done, of what this would actually cost California hospitals to come into full compliance. And, the cost impact, access, how it would affect communities, they really have no idea. I know the RAND Corporation has done some estimates that they think it will cost California hospitals anywhere from $35 billion to $140 billion dollars to come into compliance, again, for which there's no funding, and now more than 50% of California hospitals are operating in the red, have seen their cash reserves completely depleted, and so we are in a much worse position as an industry to be able to fund all this seismic compliance than we were, just 4 years ago. So definitely Senate Bill 1432 would significantly help the California hospital industry. It would positively impact CWIA, giving us more time. I think one of the things I really want to see out of it is to remove the broad brush and use a fine tip, paintbrush to go hospital by hospital, geographic location by location, and really differentiate the seismic risk of each area. We have a very sound hospital, very sound. Even though it was built in 1869, it was built very soundly, and we have been very vigilant in our upkeep, our preventative maintenance. We've made significant investments. Every milestone in Senate Bill 1953, there have been many along the way we had to make capital improvements in it. We've made them all. And so, the event of a potential collapse, the federal government said was a 0.01% chance. So it's a solid building, but it's unfortunately not, it's being treated the same as if we were in Northridge, which was everything emanated from the Northridge earthquake back in 1994. So, sorry, very, very long answer, but that's the latest. Things are happening. It's bipartisan. State Senator Shannon Grove, who is our state senator, she's actually on this committee that is putting the details behind Senate Bill 1432. So very glad she was the lone Republican that was selected, but they know that she represents one of the largest safety net hospitals in the Central Valley here. So we're delighted to have Senator Grove's support and participation.
Okay, thank you. So, although that's a lot of money, we're doing better, right?
We are.
So a couple of years ago, that just seemed like, but now that we're crawling out of...
Crawling out,
yes.
Yeah. Definitely crawling's the right word. We are by far not out of the woods. I mean, it is still a day-to-day struggle. We still have about 90 traveler nurses that we have, although the rate we're paying is down to about $100 an hour instead of $200 to $300 an hour. I think this last month we spent less than $2 million in contract labor. And when you contrast that with spending $10 million a month just a couple years ago, we're still operating in the red. So our fiscal year runs July 1 to June 30th. So with the end of April, we're now 10 months through the 12-month fiscal year. Still in the red, but April was an unusually positive month. So April only has 30 days, so you have 1 day less of revenue, but a lot of your expenses are still a full month. They're the same every month, whether you have 28 days or 30 days or 31. So April with only 30 days tends to be a little weaker. It also tends to be a little bit slower. When you look at years past and looking, before COVID, things start kind of slowing down April, May, and June, coming off the very, very busy respiratory winter season. But this April 24, we were incredibly busy. The hospital was full almost every day. In fact, I reported at our board meeting last night that yesterday morning at 7 a.m., I get a twice a day report, we were at 102% occupancy in the medical center. We only had 3 beds in medical surgical beds that were open for new admissions, and we had 35 patients that were down in the emergency department in exam rooms where the physician had made a determination they needed to be admitted, but there was no bed to admit them to. So we were literally bursting at the seams even yesterday morning. But April was a lot like that. We were busy in so many. Surgery was busy, lots of our inpatient activity, outpatient activity, very, very busy, very unusual for an April. But that translated into very positive revenue and profitability. So in the month of April, we brought in total patient revenue of a little over $51 million, which was $3.2 million more than we budgeted and $5.3 million more than we brought in of April of last year. But when you look at all sources of revenue, operating revenue, because we also receive revenue through Humana, through capitation payments. We receive, gratefully and fortunately, quite a bit of supplemental Medi-Cal funds that really come through the federal government but flow through the state to us. So cafeteria, lifestyle center, our investment in Sequoia Surgery Center, Quail Park, you look at all forms of revenue that came in. We saw $77 million in the month of April, which was $8.4 million higher than budget and $8.8 million higher than last year. So really positive on the revenue front. Then you look at our total operating expenses. So salaries, benefits, contract labor, what we pay to physicians, supplies, medications, energy, food, all those different things. Our total operating expenses for the month came in right at $75 million, which was $4.6 million higher than budget, which is not unexpected when your volumes are that much higher. You're going to have higher supply costs and pharmaceuticals and so forth. So about $4.6 million higher than budget. The bottom result is called your operating margin. So it doesn't include investment earnings yet or non-operating type revenue. But operating margin is generally the most important measure of an organization's performance and profitability. So we actually had a positive operating margin of $2.1 million in the month of April. I think that's the single largest operating margin that we've experienced over the entire 10-month period. So definitely going in that right direction. That $2.1 million positive operating margin is $3.8 million better than the operating loss that we were actually budgeting for the month of April. And when you compare that to last April, it was about $2.1 million better. So now when you throw in investment earnings, so what we call the bottom line or net income, all revenue from all sources, including investment earnings on our cash reserves, we had a positive $2.6 million for the month. Now through the 10 months, now ended April 30th, we still have a cumulative operating loss of $6.7 million, which is a lot of money. If not for the pandemic, that would stand out as the single largest operating loss in our 60-year history. We have not historically experienced operating losses. We've had lean years, but all in all, we've generally been profitable, albeit at more nominal levels. But that $6.7 million cumulative loss is $13 million better than what we had budgeted, where we thought we would be through 10 months. So we thought we would have about a $20 million loss through 10 months. So we're doing a heck of a lot better than we thought. And then when you compare that to last year, we are $26 million better than last year where we were through the first 10 months of the fiscal year. So it's been an incredible turnaround. I attribute all of that to a phenomenal leadership team, a board that makes very good decisions, continues to have a very conservative bent, but is also willing to accept that hard decisions sometimes need to be made. So I refer back often to having to lay off employees, having to close services, cut wages, freeze wages, not make matches to our 401k plan, all of those very heart-wrenching but necessary and being effective. The last thing I'll comment on, you hear me talk about a lot of days cash on hand. So it's a measure of liquidity, basically reflects how much does the organization have in cash reserves that in the event they faced the challenges, how long could they operate the hospital? So during COVID, when we were operating at significant losses every year, we were dipping into our cash reserves. We had driven our days cash on hand all the way down to 62, dangerously low, far below the minimum 90 days that we're required to maintain by our bond indenture and all those revenue bonds that we've issued over the years. Well, I'm delighted to report that as of April 30th, we were back to 91 days cash on hand, and we're projecting that will be probably close to 100 by the end of the fiscal year on June 30th.
So do we get that money back that we're having to hold in that reserve because we went under 90?
Yeah, so we have 18, well, you listen carefully, huh? Yeah, good job, Deborah. So when we had the first report, I think it was in December 31st of 22, we failed to meet the year-end debt covenants around our debt service coverage ratio, meaning how much profit, how much net income are you generating in order to pay your principal and interest, and then how much do you have in cash reserves, that liquidity measure. So we failed to meet both of those, and that triggered not a default on the debt, but a non-compliant situation. And so we had to move $18 million of our cash reserves into a trust account that can only be used by the trustee in the event we were to default on our debt and not be able to pay the principal and interest. So we have to demonstrate for a longer period of time. So just hitting it
Not
this
just a
June,
couple weeks.
no, unfortunately not. I think we have to be in compliance for 18 months before they will let go of that money. So we did have our credit rating though. We're still down at the BA1 credit rating, which is not where we want to be, especially when we've been at an A rating most of our existence. But our credit outlook was upgraded from negative to stable by Moody's. So that was a very positive sign. And so definitely things are moving in the right direction. Unfortunately, there's definitely strong headwinds, a couple gut punches to us. So Senate Bill 525, which I've talked about, is the minimum wage for healthcare workers. So eventually, within a short period of time, all California hospitals will have to offer every single one of their healthcare workers a minimum wage of $25 an hour. And then it will go up as scheduled after that. So when you couple that regulatory change with also we still continue to have a tremendous healthcare workforce shortage in California and across the country. And so we've had to make adjustments to nursing salaries and other, clinical lab scientists, physical therapists, just to stay up with the market and be able to retain employees. And so between Senate Bill 525 and those market pressures, we're going to be adding $30 million to our operating expenses in additional labor costs. And so that's already going into effect. We already started having to put those wage increases in place in February. That came with no reimbursement increases by the state or any payer. But you've heard me also talk about the managed care organization tax that was signed into law by the governor, retroactive back to April 1, 2023, where over about a 3.5-year period, it would generate over $19 billion in new funding. And the governor had promised, he'd pledged that he was going to use about half of that to increase Medi-Cal reimbursement rates to doctors and hospitals. And so we've been jumping for joy over that. However, the governor just informed us a couple weeks ago that he came out with his May budget revision, and now he is looking at a projected $45 billion deficit for next fiscal year. So he has said, I'm sorry, hospitals and doctors, you're not going to get a penny of this MCO tax. In fact, I'm going to take it all to balance the budget until throughout the entire program. So we will not see a penny of the $19 billion that he will collect between now and December 31st, 2026. And in fact, he has gone to the legislature and the federal government to ask them to increase the amount of the MCO tax by billions more, a higher tax on the managed care health plans, to provide funding to help cover his budget deficit. So very disappointing to hear that. So once again, hospitals were on our own to figure it out. And I think the governor and the legislature take comfort knowing that the hospital industry is a tough, resilient industry, and that we're our own worst enemy, where we always do find a way to figure it out. Cahuilla has found a way to finally, to get back on its feet and make the very difficult decisions, and is probably going to force us to make, additional tough decisions in the future.
Well, we've talked about those tough decisions on these calls before, and you continually say it's a lot more fun to grow our way out of this than to
Yes.
have to do additional layoffs, and which kind of goes into the next question. The Sun Gazette did an article on us looking at a future surgery site out at Sequoia Gateway. And so lots of attention to that,
Yes.
that meeting, of course. But the question is, what is the time frame for a new surgery center out at Sequoia Gateway? This is the property out on 99 in Caldwell.
Yes, thank you. Yes, definitely more fun to grow yourself back into prosperity than to cut your way there, is my phrase I use often. And the Gateway Project is designed to do just that. So the Sun Gazette, bless John Lint, he's a phenomenal freelance reporter, and he pores over every board minute, committee minute, and so we've been talking to our board about this project, and John picked it up and wrote an article. It was a bit over the skis in that it's still in the definite study exploration phase. And the Sun Gazette article, which was then followed by Becker's, both reported as if it was a done deal. And it is by far not a done deal. So Kauai did purchase 7 acres of land out at Caldwell 99. That's in the same area that Valley Children's Hospital purchased 6 acres for a potential future clinic. We are also looking at potentially purchasing an additional 4 acres adjacent to that 7 acres. That would give us even more room to develop really a healthcare campus out there. But we've been working with 2 different firms. An ambulatory surgery consulting firm by the name of Amblitel, and then a real estate development, physician development company called Montecito out of Tennessee. Montecito is the company that bought the 5-story building next to our helipad. So they now own that building, bought it from some local investors, and we lease that building from Montecito. And so they have been finalizing their financial feasibility study to see if it makes sense and how big should it be, what services should be provided, what kind of revenue will it generate. We're working closely with our partners at Sequoia Surgery Center. That is a joint venture between Kauai and a dozen or so surgeons. The surgeons own 70% of Sequoia Surgery Center. We own 30%. That building is 30 years old. It only has 4 operating rooms, so very limited. So we've been working closely with our partners there about potentially developing this new, modern, larger ambulatory surgery center on that Caldwell and 99 location, and bringing Sequoia Surgery Center there. Much of traditionally outpatient surgery done in a hospital, like a knee replacement or a hip replacement, more and more, those are being moved out of the hospital. In fact, Sequoia Surgery Center now has a very robust joint replacement program there. And so, you know, that by moving a lot of that outpatient elective surgery out of the hospital and moving it out to this new ambulatory surgery site will also give us increased capacity to grow inpatient surgery, because we operate 14 operating rooms, but they're full all the time. And so we have additional surgeons that are asking for more block time, and so this will serve a lot of purposes, bringing a very modern, state-of-the-art surgery center to the community with ample parking and close proximity to the 99 and other surrounding communities, but also freeing up space at the Kauai Medical Center as well. The exact timing of when we'd turn dirt and when it would be, you know, operating, I don't know that yet. So next Tuesday night, we will be presenting the preliminary feasibility study to some of the leaders at Sequoia Surgery Center, the physician leaders, to assess their interest and really to answer a lot of the questions they have and to have them help help us test the assumptions that we've made relative to growth and, you know, how much of the surgery done at Kauai could actually be moved out there and so forth. So as soon as we, you know the answers to those questions, we'll definitely be sharing them first, you know, with our community groups.
Yeah, so when we talk about growth, I was with a local builder last night, and he was talking about all of the housing that's coming into Visalia, and he was rattling off just 69 houses over here. So, you know, all of this building.
Right.
And the only thing that was just running through my head was, we don't have the doctors in this area to meet the needs of what we have here. How many physicians are we short?
Oh my gosh.
It's
So yeah, every couple of years we do a formal physician needs assessment, and we just completed it. And I can't remember the total number, but it's significant. I was just meeting with our cardiologist yesterday morning, and that report showed that we have a shortage of 4 full-time cardiologists, interventional, electrophysiology. Yes, and I think the only specialty where we have a sufficient number of physicians to support the population is in nephrology. So kidney disease and dialysis and so forth. So J.C. Palermo was reporting last night to the board that over this last year, I think we recruited 17 new specialists to join our organization and our community, but we're just scratching the surface, which is a big motivator behind building this new ambulatory surgery center. Is we hope that will, physicians being given an opportunity to have ownership in the facility in which they practice is very appealing and attractive. Many physicians want that. And so we hope that this will attract other physicians to practice there, as well as bring new surgeons, cardiologists, new physicians to the community. And we did, it was disappointing to learn that the Great Wolf Lodge backed out of that project. They were going to be the anchor tenant at Caldwell 99, and they backed out. That land is now being sold to a developer that wants to develop commercial, restaurant and maybe a movie theater, things like that, but also a significant amount of residential housing as well. So we look at what's going on in Northwest Visalia and all the development out there. So it looks like we'll start seeing some in South and Central West Visalia as well.
Very interesting how it all just, it's like, you have to wonder, are city officials aware of the shortages? Because healthcare is a major pillar,
right?
In areas.
Yeah, I always think, the three-legged stool to a vital society and community is health, safety, and education. And myself and my executive team, we meet on a regular basis with Leslie Caviglia and her team to talk about joint issues. So we keep them very informed. They keep us very informed. I think our city council, our city leadership does a phenomenal job, unique job in California of, really ensuring the concentric growth. So many San Joaquin Valley towns, they move north and they abandon the southern parts of their city. And our city leadership has not let that happen. And so I really appreciate that you see development in the Northwest, the Southwest, the Southeast, the Northeast, and I hope future city leaders will continue with that commitment.
Yeah, and once they build the housing out on the Southeast, which is getting ready to go in there, we'll probably be looking at the 20 acres that we have on Caldwell and Lover's Lane.
Yeah. It just, I think back, we bought 22 acres of empty land at Acres, between Acres and Cypress and Tulare, what we call our West Campus. 22 acres. There's not a stitch of undeveloped land now. We've developed the Lifestyle Center, the Cancer Center, imaging, mental health, rehabilitation, dialysis, the Surgery Center. It is an impressive, expansive campus that was just 22 acres of bare dirt. And so who knows what the Southeast will look like in a few decades.
Growth is fun.
Yes.
Okay, so we're gonna wrap it up with a question. A couple of months ago, you did an in-person community ambassador meeting about the United Healthcare contract and Kawea parting ways. And so you mentioned in this meeting, and so this is part of the question, that it's happened before in the past with other health plans, and we've always managed, maybe they've changed their mind, or we've managed to work out the contract negotiations. So this has come up in the last week or so, and a community referenced that statement and then asked if there's been any changing of its mind with United Healthcare, or if not, is this hurting Kawea financially?
Yeah, and I unfortunately I wasn't able to get the answer to that question. Kim Ferguson, who's our Director of Managed Care and heads up all of our negotiations, I don't think she's in the office today. I reached out to her to see what is the latest update, and we weren't able to connect. I will tell you, I don't think it's hurting us financially, because I think I mentioned what's interesting is we work with a lot of Medicare Advantage plans. So this was the contract that was terminated was United Healthcare's Medicare Advantage, their Medicare HMO, like Humana and these other plans. So it wasn't their commercial plans, their HMOs or PPOs. It was just the Medicare Advantage plan. But we see lots of Medicare Advantage patients from other Medicare Advantage plans that we don't have contracts with. But if a hospital accepts Medicare patients that are, say, covered under the fee-for-service program with the federal government, you're required to accept Medicare Advantage patients, and you agree to accept what Medicare would have paid you had they been under fee-for-service. So still trying to figure out exactly, going from a contracted provider to a non-contracted provider, just how is that really going to restrict access to Kawea and services and facilities. So I'll follow up with an answer to that. What's interesting is that this is now, it's not just Kawea, it's going on all over the country. The relationship between providers, hospitals, and health plans has deteriorated significantly. And it's been exacerbated because of the financial condition that hospitals are in. They're still struggling. And with so little funding coming from Medicare and Medicaid, we look often to those commercial payers, those for-profit health plans like United Healthcare. So there's a hospital system out there called Common Spirit, one of the largest hospital systems in the United States, close to 150 hospitals. They just terminated their contract with United Healthcare for the very same reasons that we did. So you can imagine the impact that will have on the enrolled Medicare population. The California Hospital Association just filed a lawsuit against Anthem Blue Cross because what's happening is Anthem Blue Cross patients that have been admitted and cared for in an acute medical center like ours, but are ready to be discharged either to skilled nursing, a nursing home with home health services, that Anthem Blue Cross is denying authorization or dragging their feet and allowing these patients who should be discharged, and we are no longer getting paid for by Anthem Blue Cross. They are just languishing in a bed, still having to be cared for by our nurses, but it's costing California hospitals billions of dollars. And so I can't remember ever the California Hospital Association suing a payer, but that's what's occurred now. And we're seeing, again, more and more. Congress is looking at several bills to rein in this bad behavior by health plans. They're using AI, artificial intelligence, to just arbitrarily reject claims just randomly without any basis, but just applying an algorithm that just denies payment and waits to see if the provider is going to contest it. And a lot of these smaller hospitals, they don't have the resources, they don't have the wherewithal to go to, fight a big health plan like United Healthcare. And so they write it off and just give in. So it's very, very much an unfair business practice. And I'm glad to see Congress and the California Hospital Association pushing back.
Very interesting. Okay, so before I let you close us out, I just want to give an announcement to remind everybody about the GME, or the Graduate Medical Education Program. Their new resident mixer is on Monday, June 24th. And so this will be either right after we do our June webinar or right before. I don't know the date off the top of my head. But we want our community members to come out, welcome these new residents. How many do you know if it's between 40 and 50 new residents?
It's between 40 and 50. Yeah,
Yeah.
I think it's like 47 or something like
Okay.
that. I'm not positive. But
Okay,
yeah.
and so, you know what, our goal is to recruit those physicians to stay once they are here, and so we know that our community members are a key player in that, and so we like to invite you to come out and just meet these new residents and introduce them around for the evening. So, and that's all I have, Gary.
Okay, well, we're at the bewitching hour, so to speak, so I just want to thank everybody for joining us at this month's Community Engagement Huddle. And thank you. I saw a number of our community engagement folks, whether you're a CAC member or EDAC or PFAC or an ambassador. It was great seeing some of you at the Reflection Garden dedication yesterday. So thank you for continuing to be very engaged with Cahuilla Health and continuing to listen in on these huddles. Thank you for your questions. Keep them coming. And you don't have to wait if you got a burning question that you just got to have the answer, because again, I want you to be the most informed people as part of the Cahuilla Health family. So just reach out to Deborah or me directly. And we'll get you that answer. So in the meantime, I hope you all have a wonderful Memorial Day holiday. Looks like it'll be pretty nice weather. I think saw it down in the low 80s. So nice for barbecues and garden work and stuff like that. So, all right. Thank you, everybody. And stay tuned.